My name is Sophia. I am going into 6th grade, and in my free time I like to do gymnastics, or I like to sit in my bed and read or write songs.
Sophia was diagnosed with scoliosis when she was 7 years old at a well-visit appointment. We first saw an orthopedist. He had told us possibly her curve could straighten out over time. Unfortunately, that didn't happen. We went back a year later and her curve had progressed significantly to about 26 degrees.
Being diagnosed with scoliosis has been a really rough time because it has put kind of a dent in my confidence.
As a mom, it's really hard to see your kid go through something like that. I wanted to seek another opinion, so I found Dr. Riley through a neighbor of mine actually who had recommended Rocky Mountain Hospital for Children.
Her curve was already a pretty intense curve, so I was already fearful that it would become something that might need surgery one day. And then as time went on, unfortunately the scoliosis got worse despite all of the things that she was trying, and that's when things intensified a little bit and we started talking a little bit more about surgery.
So I found out about VBT surgery and how they could essentially put a tether cord on your spine and help children grow so that there would be a fusionless option for children.
So she just happened to fit the criteria perfectly. Do you remember what those criteria were? What makes you a good candidate for this surgery?
My growth plates down here are still at a 0, so that means that I'm still growing quite a lot.
So, and then we need a curve that is big enough to where we would reasonably assume if we leave this alone, she's going to have surgery one day anyway. Everything thankfully went according to plan, and when she woke up, all of her toes were wiggling, everything looked good. And so yeah, the names we give her of Brave and Pioneer, they're well deserved, but they're going to be ongoing too. She's going to need to keep going that way. We'll need to continue supporting her in those ways and just making sure that this turns out the way that we really want it to.